An oxygen concentrator is like a device that can be used even at home, which takes in the atmospheric oxygen. Atmospheric oxygen has oxygen at 20 or 21% concentration, and it extracts only the oxygen from that, concentrates it, and delivers it through the outlet. What we are advising now is not necessarily individual households to buy oxygen concentrators, but either communities like a building complex, a society, or even offices to buy a few oxygen concentrators so that if the resident in the society or an employee in the office needs it, then they have an oxygen concentrator. The reason why we're advising to have these oxygen concentrators are because, as we know, most cities and towns and villages in India are facing an acute shortage of ICU beds and oxygen. And oftentimes, when a person with COVID 19 requires hospital admission, it's mainly for oxygen. And when they are unable to find an ICU bed, they only get delayed at home without proper treatment. And the most important part of treatment of COVID 19 pneumonia is oxygen. And an oxygen concentrator will deliver it so easily at home, during which time the patient can, the relatives can go ahead and find the bed for the patient over the next few days. People need to remember that oxygen concentrator only deliver oxygen at low flow rate, so around 5 liters per minute to 10 liters per minute. And yes, in most COVID 19 patients who are picked up early in that phase, this flow rate will be sufficient for the patient. Patient with COVID 19, especially the mild and the moderate pneumonia, have oxygen concentrations, if they have oxygen concentrations between 90 to 93, what might be enough is just a low flow rate through an oxygen concentrator, which will help the patient build up the oxygen concentration or the saturation to 94 and above. Sometimes when there is severe pneumonia, then the flow rates that is provided by the oxygen concentrator is not enough for the patient to maintain saturations of 94 and above. In that case, there are other things that can be done only in the hospital that cannot be done at home, which is like high flow nasal cannula oxygen or using a BiPAP or a ventilator, and those things can only be provided in the hospital. So oxygen concentrator is useful to a certain subset of people who are picked up early and who do not require oxygen at very high flow rates. And for those, it's an excellent option for both at home and in the hospital where oxygen might be short. That's not true, because oxygen support is only one part of the treatment of a person with COVID 19. So using an oxygen concentrator to deliver oxygen to a patient at home is not the ideal scenario. It's an alternative scenario while the patient is able to find a hospital bed. Because a person who has hypoxia or low oxygen concentration in the body is someone who needs to be under very close medical follow-up. The oxygen concentrator can work 24/7. And how long does the patient actually need it depends upon the health of the patient. Sometimes it often takes a few days for the patient for the recovery of the lung and for the patient to stop requiring external oxygen. So the other thing that people can do at home to improve their oxygen saturation when it starts dropping is sleeping on your chest or sleeping on your tummy. We call that prone ventilation. That helps improve the oxygen saturation a bit. The other thing is deep breathing exercises, as if you were blowing into a balloon. So deep breathing exercises also help improve the oxygen saturation. And these are little things that can be done at home while we find a bed for you in the hospital.